Ladies and gentlemen, we're about to get started. Thank you all for coming. If we could all take our seats, we're about to get started. Thank you all for coming. My name is Vinnie DeMarco. I'm the president of the Maryland Healthcare for All Coalition, and we love the Waxter Center. We've been here several times before, and today is the second to last of our series of forums across the state to highlight the progress Maryland is making in making high-cost drugs more affordable for our people. The basic message is drugs don't work if people can't afford them. Drugs don't work if people can't afford them. And we are doing something about it. And I'm thrilled to introduce first one of my neighbors and one of our heroes, Mayor Brandon Scott. Mayor Scott was a strong supporter of prescription drug affordability before the law passed and has been helping us tremendously to implement the law. I know he has to leave. He's on a tight schedule. I'm thrilled that he took the time to be with us. So I'm going to start by letting the mayor welcome us and begin us going, and then we'll go on to our other speakers. Thank you, Mayor Scott.
Thank you, Vinnie. Thank you. Yes, Vinnie, our neighbors in Northeast Baltimore. Thank you for your partnership and for bringing us all here today to discuss this critical challenge that many of our residents are facing, and that's, of course, the rising cost of prescription drugs. We know how important it is, and as Vinnie said, very simply, but I think that's the most important thing that we're going to hear today. If people can't afford them, then drugs don't work. You can't have something work for you that you can't put in your body because it costs too much. I want to express my gratitude to our valued partners that are joining us here today. The Maryland for All Coalition, represented by Vinnie and his dedicated team. Andrew York, the Executive Director of the Maryland Prescription Drug Affordability Board. AARP Maryland with Jim Gutman representing AARP, Claudia Baylog, who's representing our Baltimore City Commission on Aging, our Health Department, our Deputy Health Commissioner, Commissioner Ton is here to represent the department. And I also like to thank the Department of Health for their diligent work in helping to organize this event, and a warm welcome to our gracious host, the Waxter Center, led by the fabulous Miss Lori Fagan. Thank you for having me back at the Waxter Center again. It's with great pride that we come together with all of you as residents of the city of Baltimore to shed light on the pressing need to make prescription drugs more affordable for everyone. Maryland stands as a trailblazer with the first ever prescription drug affordability board in the nation, committed to making the high-cost prescription drugs more accessible to Marylanders. I recognize that lowering the cost of much-needed prescriptions for our residents is critical in safeguarding their health and their well-being. And this places an undue burden on individuals, families, and let's be very clear, also our healthcare system. Since the beginning, as you heard from Vinnie, I've been a champion for the creation of this board and have always been actively involved in its implementation since the early days. Since its inception, the Prescription Drug Affordability Board has been very hard at work, laying the groundwork to make high-cost drugs more affordable for all of us. We eagerly anticipate the initial steps the board plans to take in partnership with state and local governments. I'm honored to host Maryland Healthcare for All Coalition, AARP Maryland, and everyone here for a community forum like we did on drug affordability, much like we did in 2020. 2020 was virtual. In 2022, we're able to do it in person, and these forums serve as a platform for Baltimore residents to share their experiences with high-cost prescription drugs. It's evident that there is much more work to be done to strengthen the Prescription Drug Affordability Board. Thank you all for continuing to working towards making prescription drugs more affordable. I want to encourage everyone to tell your story. Tell the stories of you, your family, your friends, those folks that you know intimately went through a struggle with health because you could not afford what medication you needed. And use terms like costs and rates or upper payment limits when discussing the Prescription Drug Affordability Board and addressing them and the associated issues, because that's the message that we need everyone to hear. We need folks to hear those words, hear your stories, feel what you have been going through so that together we can address the cost of prescription drugs for everybody once and for all, not just here in Baltimore, not just here in Maryland, but across this United States of America. Thank you very much, everyone, for allowing me to speak today. Thank you, Vinny, for all the hard work. I do have to step out. I have to get in a truck and go to Washington, D.C. to fight on behalf of all the Baltimoreans, but wanted to stop by here today to say this is something that we can accomplish if we keep this coalition strong and we focus on this issue together. Thank you very much. Vinny?
Thank you, Mr. Mayor, very, very much for all your incredible support. Mayor Scott and his fellow local leaders from around the state are working with us to fully implement the Prescription Drug Affordability Board, including passing legislation in 2024 to extend the authority of the board to make high-cost drugs more affordable for everyone. You're going to hear today how the Prescription Drug Affordability Board is helping Marylanders now, the additional authority we want to give them, and what we need from you, which, as the mayor said, is your stories of how high-cost drugs are hurting you. I want to alert you, there's a packet that we have. If you don't have it, raise your hand. We'll make sure you have one. And in this packet is an op-ed that was published in The Sun by myself and my son, Jamie DeMarco, about how President Biden's wonderful Inflation Reduction Act is helping make high-cost drugs more affordable for people on Medicare. There's someone there that doesn't. People on Medicare. That is very, very important. Starting in 2025, nobody in Medicare will pay more than $2,000 a year for their high-cost drugs. That is great. Thank you, President Biden, Vice President Harris. But we need to do more to help people in Maryland. And that's what the Prescription Drug Affordability Board is all about. So we're going to start our program today, thank you, with the welcome from the mayor, with and Andrew York, Dr. Andrew York, who's the wonderful and terrific executive director of the Prescription Drug Affordability Board. After the board was enacted and created, the first of its kind in the nation, which other states are replicating, the chair was picked by the Senate President and the Speaker, Van Mitchell, former health secretary, who's doing, bye Mr. Mayor, thank you, who's doing an excellent job, and including, one of the main things he did, he was pick Dr. York, who's a pharmacist, a lawyer, and has training at the state and federal level on how to make high-cost drugs more affordable. And Dr. York is going to tell us on what the board is doing right now to help us all afford our high-cost drugs. Dr. York?
Great. Thank you, Vinny. And thank you to everyone else on the panel today. And thank you for your time and the chance to talk to you. So my name's Andy York, and I'm the Executive Director of the Maryland Prescription Drug Affordability Board. And I just wanted to provide a quick update on our work. So we're a first in the nation independent agency dedicated solely to making prescription drugs more affordable for Marylanders. And this is a pretty exciting time for us. We have two big projects that I'm going to mention, but the main takeaway for today is that the patient's voice is going to be absolutely essential to our work. So there's two big things that we're working on. One is that we're working on something called cost review, thank you. And that's basically the chance for the board to select certain drugs that are causing patients, or that patients can't afford, and actually letting us look under the hood and understand why they may or may not be unaffordable. So the big thing that's happening in the drug pricing industry is we see this very high gross cost, but often we can't see what's happening behind the scenes between the insurers and other folks. So this gives us the chance to look at what that process looks like. So our regs we're hoping to publish final regs after November, which means we'll be selecting our first round of drugs in January. And the big takeaway for everyone here is that we're going to have a way for patients to report to us which drugs they can't afford. And that's going to be a very, very important element for board members as they select drugs to do their cost reviews on. The second thing that we're working on is something called upper payment limits. And again, this is an extremely novel and new policy. And we're developing something called the Upper Payment Limit Action Plan, which says which drugs we can set upper payment limits for, how we'd actually go about calculating that upper payment limit, and then how we make sure that that flows through the supply chain and gets back to the patient. And the big takeaways there is that our board made it clear that they want any savings that comes from this to go to the patient. So that was one of the big takeaways. Next, they want to make sure that they can account for everything in terms of how they go about identifying what is the correct cost for a drug. And then finally, they made it clear that they want this to work. They actually want this to be implemented and want it to work. And again, I'll just end where I started, basically saying that we're here for patients. patients, and the patient voice is absolutely essential for us. So please tell us your stories, and we look forward to keeping in touch and let us know how we can help. Thanks so much.
Thank you, Andy, for your great work. And while the board is setting up its way of collecting stories, I want to refer you to this packet, and there's a QR code at the back where if you use that or go to the web link on there, you could tell us how high-cost drugs are hurting you or your families, and we'll pass all that information on to the board. This information is critical for the board to be able to determine how to make high-cost drugs more affordable for everyone. And I want to emphasize, we at the Healthcare for All Coalition are very proud of our First in the Nation board. It is leading the way, but it does need more authority that we are pushing to enact in 2024 legislation to allow the board to make high-cost drugs more affordable for everyone, including state and local governments. Next, we're going to hear from Dr. Hyang Tan, who's the Deputy Commissioner of Health in Baltimore City, and she's been a great proponent of public health in so many ways, and has been wonderful in helping us work this event together and to get the message out about how high-cost drugs need to be made more affordable. Dr. Tan?
Good morning. I think Vinny just gave me a degree that I didn't think I had, so thank you. Appreciate that. Good morning, everyone. My name is Hyang Tan. I am the Deputy Commissioner of Aging at the Baltimore City Health Department, and I'm so delighted to be here today and bring you greetings on behalf of our Acting Health Commissioner, Mary Beth Heller. Wanted to welcome you all to the Waxer Center, and I wanted to convey my appreciation first to our guests joining us in the audience today. And hello, Waxer Center members. Yay. And today we have a special event following this event called the Waxter Wisdom. So I wanted to welcome all of our family caregivers who are here today and wish you all a happy Family Caregivers Month. Before I get started, I wanted to also say thank you to the dedicated individuals who are up here today with me. Wanted to acknowledge our mayor, Mayor Brandon Scott, for his unwavering commitment to making prescription drugs affordable for all Baltimore City residents. He's a leader who recognizes that healthcare is a fundamental right and not a privilege. We stand behind him in his efforts and vision for making Baltimore a healthy and equitable place for everyone. And to Vinnie DeMarco and the Maryland Healthcare for All Coalition, who have demonstrated unwavering commitment and advocacy in this crucial fight to making affordable prescription drugs affordable to all. To Dr. Andrew York for leading our first ever prescription drug affordability board in the country as its executive director. I have to say this is a really big deal. When I go around the country, people ask and talk about our board. And so they're really looking at Maryland at the forefront, and other states are looking at us as trailblazers, making prescription drugs affordable for everyone here. I also wanted to highlight the many contributions of the organizations and leaders that are on this panel. The Commission on Aging Resources Empowerment, Claudia Baylog, who's representing the Commission, the Maryland ARP, Jim Gutman, and our dedicated faith and community leaders, including the Reverend Dr. Sandra Connor, who you will all hear from today. They are steadfast champions for the fight and needs of Maryland older adults, not just on prescription drugs, but on many other issues. So really looking forward to hearing from them later on. Lastly, I wanted to extend my great appreciation to my team at the Baltimore City Health Department. This is our second year hosting this forum at the Waxter Center. I especially want to recognize our terrific center director, Miss Lori Fagan, who's probably running around. Oh, there she is, in red. This forum annually brings us together to discuss the importance of affordable prescription drugs for all Marylanders, especially for Baltimore City residents here today. So looking forward to hearing from each of you also. For those of you who do not know, the Baltimore City Health Department serves as the designated area agency on aging for Baltimore City. As your local AAA, we offer programs and services that connect individuals to affordable healthcare options. And I'm going to use the rest of my time today to talk about Medicare open enrollment and the services we offer at the health department to help you navigate through open enrollment. As many of you are aware, we're currently in the middle of Medicare enrollment right now. I don't know why, but Medicare enrollment is only open for a certain part of the year. And we are very busy at the health department to help navigate those who are new to Medicare to the system and those who are looking for other plan options and help you navigate and counsel the various options that we have. To schedule an appointment with our SHIP counselor, our state health information program counselor, you just have to reach our Maryland Access Point. There are resource directories up front somewhere, but the Maryland Access Point is our Aging Disability Resource Center. Phone number, we have SHIP counselors at hand to help you navigate through open enrollment. The phone number there is 410-396-CARE or 410-396-2273. The SHIP counselors are available from Monday to Friday, 8:30 to 4:30. And if you call after 4:30, you'll reach United Way 211, our partners who will gladly take your call after hours. I want to add that one of the most critical challenges we see older adults face when choosing their plans, especially Medicare Part D plans, is finding what covers their prescription costs. There are many questions that an older adult have to consider when they're choosing their plan. What can I afford? What are premiums, deductibles, co-insurance costs? And at the end of the day, are my medications on this plan's list of covered drugs? And the SHIP counselors at the health department will help you navigate through these options and help you find the best plan and the most affordable plan so that you can afford those prescription drugs. Every year, Medicare beneficiary must evaluate what they can afford and whether they can continue to afford medications they need. When you factor in the rapid cost of prescriptions and everything else, you create a situation for older adults where they're forced to make difficult decisions and trade-offs, choosing between food, prescriptions, rent, home repairs, and in-home care services. There shouldn't be trade-offs to make because cutting back on these essential things can jeopardize aging in place and your independence. And so older adults who have raised families in our city, who have made valuable contributions to the communities, have fulfilled their part. And as advocates for older adults, we have to fulfill ours. So we firmly believe that help with financial needs such as is a basic expectation of our state and our country. We are encouraged to see the Maryland Prescription Drug Affordability Board taking on this vital aspect of this challenge, and we're pleased to be continued partners in this important work. Thank you very much.
Thank you, Deputy Commissioner Tannen. Thank you for all the great work. And thanks for mentioning the SHIP program. And in this packet, again, if you don't have a packet, raise your hand. We'll make sure you have one, is the phone number that Deputy Commissioner mentioned. There are packets up here. We'll make sure you get them before you leave. That the phone number you call if you have problems with Medicare enrollment. And again, you can use the QR code at the back to tell us your story about how high-cost drugs are hurting you. Next, we want to hear from Claudia Balog, who's here with two hats. One, she's a leader of 1199 SEIU, one of my favorite organizations that did more than almost any other organization to get the Prescription Drug Affordability Board enacted. I want to also recognize Ricara Jones, political director who's on our board. We love 1199 for all your terrific work. But Claudia is also co-chair, as Deputy Commissioner said, of the Baltimore City Commission on Aging, and in that role, I'd love to have her speak here. Thanks.
Thanks, Vinny. I got a promotion, too. I'm here as a member of the Baltimore City Commission on Aging, Resources, and Empowerment. Our commission members are appointed by the mayor and city council to advise the city on a number of issues of concern to older adults who live in Baltimore City. We are advocates for older city residents, whether they're living in their own homes, in nursing homes, or assisted living facilities. We advise the mayor and the council as to how city agencies can improve their services and whether new programs are needed to respond to unmet needs. So the high cost of prescription drugs is an important issue for our commission for several reasons. One, older adults in Baltimore City face much higher risks to their health status and their ability to maintain independence than their counterparts in other jurisdictions. So census data shows that Baltimore residents who are 55 and over face more than twice a likely chance of living below the poverty line as in other counties. We have a significantly higher risk of having a disability, including ones that affect mobility or vision or self-care. And finally, Baltimore City residents over 55 are much more likely to live alone. So higher prescription drug costs compound these risk factors. Older city residents, we've already heard this, we're gonna say it again and again. Too many of us are forced to choose between paying for food or housing or our prescription costs. And if an older patient is trying to manage a chronic medical condition, taking medications consistently is part of that treatment regimen. If patients can't maintain their prescription schedules because they can't afford the drugs, they expose themselves to the possibility of acute care episodes. This is especially true when high-cost specialty drugs are prescribed. These avoidable acute care episodes impact all of us. They impact our entire healthcare system. Now, fortunately, we've heard some good news, right? We've made real progress in the past few years addressing the high cost of drugs. The Inflation Reduction Act, as it's implemented, will begin to have an impact on high prescription costs for Medicare beneficiaries. And our Prescription Drug Affordability Board in Maryland, a trailblazing thing that exists as it sets upper payment levels for high-cost drugs, it will help reduce prescription drug costs for many city residents. But, there's always a but, we need to continue this work. We need to highlight the impact that high-cost prescription drugs are having on older adults, are having on our daily lives, particularly in this city where too many live below the poverty line or maybe just above it. Failure to address this issue impacts all of us in the form of increased hospitalizations, deteriorating health for older adults, too many, far more burdens on family caregivers, and higher post-acute health care costs. So I want to thank you for allowing me to speak today. Our commission, again, is an advocate for everyone here. We want you all to raise your voices continuously on this issue. We will make these changes. Thank you.
I'm sure promoting everybody today. So thank you all for your great comments. And Deputy Commissioner Tan and Commissioner Balog made this point. Drugs don't work if people can't afford them. That's why the Inflation Reduction Act is such tremendous progress. Thank you, President Biden and the Prescription Drug Affordability Board. I mentioned the great support of 1199 as one of our leaders of our coalition. Also, in the audience is Jonathan McKinney with the NAACP. The NAACP fought very hard this law, as did CASA Maryland. Thank you, Nympha Amador here on behalf of CASA. Thank you for your support. But one organization has been working on this issue in Maryland and across the country is AARP. And we're thrilled that with us is Jim Gutman, who's an AARP leader. And in addition, he's on the Stakeholder Council of the Prescription Drug Affordability Board, making sure that consumer voices are heard by what the board does. So thank you, Jim, for being here. All yours.
Thank you, Vinny, and it's great to be here for multiple reasons. First and foremost, on behalf of AARP, AARP was a strong supporter of the legislation that led to the Prescription Drug Affordability Board in Maryland. I was privileged to be able to testify in favor of that on behalf of AARP, and our state director, Hank Greenberg, has already said that we will strongly support in the next General Assembly the legislation to increase the board's powers so it can do what it needs to do to lower drug costs for our citizens. Second, you heard Vinny's reference to the Stakeholder Council of the Prescription Drug Affordability Board. I am one of the public members of that council, and that means I represent you. So I want to hear your stories and what we need to do to help the board do things to improve the conditions for all of you. And finally, and thank you, Dr. Tang, for making the point, I am a SHIP volunteer counselor during the open enrollment season on prescription drugs. I do it in Howard County, but let me put in a plug for SHIPs overall. They're great. They do not charge a fee for your consultation. We are in the heart of open enrollment, so if you want an appointment, now is the time to call and try to set it up. Open enrollment expires December 7th, and the counselors in Baltimore City, just like here, are dedicated, as in Howard County, dedicated to helping you on those things. The other thing I wanted to just lead into is what's going to happen next year in the General Assembly, what we hope will happen. It's really important for us to make the strongest case possible to expand the board's powers so it can do for you what it needs to do. The board is off to a great start. They're looking at multiple options aside from upper payment limits that will have an effect in everybody's pocketbook. And we need your stories again to help make the case in the General Assembly. So AARP will take those stories, as will others, and use it to testify and make the strongest case so we can get this great board moving even further than it has already. Thank you very much.
Thank you very much, Jim, and thank you for AARP. None of our progress on prescription drug affordability or healthcare expansion or anything could have happened without the faith community. So I'm going to ask to come up together the two best-dressed people up here, Reverend Sandra Connor, the first woman president of the Night Baptist Ministers Conference of Baltimore, and Imam Earl Al-Amin, and together to speak for the faith community to all of you.
Good morning, everyone.
Good morning, everyone.
I just stand before you to let you know that from a faith perspective, it is our job, and he's going to speak from the faith perspective. I just want to let you know that we're here representing the faith community to say that we care for you. We care for you, and just as we care for ourselves. In my Bible, it says, there's a passage that says in 3 John chapter 1, verse 2, that we care for your soul, that your health is well as your soul. So it's not only your soul that we want to make sure that you're okay spiritually or whatever. We want everything about you to go well. One of the things that keeps you from going well is your health. And one of the things that keep your health from going well is the high cost of prescription drugs. I stand here to tell you that we want you to get involved, to hear something, say something, do something, tell your stories and give it to Healthcare for All, and there's some information on the back of the package that you have, as well as to use the QR code that you have. We want you to get engaged and get involved. We want you to tell the stories not only to yourself, maybe it's not you, maybe you can't afford all your drugs, maybe where you live there's somebody that's struggling. And let me also say to you, if you know anybody who cannot afford their drugs, they can also intimately dial 211 that they can get some help for their prescription drugs. We want to let you know that we want you to do whatever you can to be healthy. The Bible calls for us to love God and to love thyself, but to love our neighbor. We are each other's neighbor. We got to keep on loving on one another and making sure we're all well and healthy. If you're not well and healthy, things can and won't happen in our states. Now, one of the things I heard today that I want to repeat and say loud and clear, we talk about the crime in Baltimore City. The one thing that we don't talk about a lot is we don't celebrate our successes. We need to celebrate the fact that Maryland has the first health prescription drug affordability board in the nation. We need to, like we do at the Orioles game, you all need to clap for that because you all were a party of that, because you come to the forums and you make it known that we want to have a prescription board, affordability board that will make a difference and care for you and the high cost of drugs. So we ask that you continue to see something, do something, and I'm gonna let my partner who's here, who I kind of kidnapped, but he's here.
Once again, good morning. She said enough. So what I'm going to close with and say that the mosques, the temples, the churches, the synagogues, all of our colleagues are in support of these great initiatives. And in closing, I'd like to say this. Let the people say, amen.
Thank you. Thank you, Reverend Connor and Imam Earl Al-Amin. We appreciate it very much. Before we close, I want to make sure you know a couple other people in the room. Deputy Directors at Healthcare for All, Catherine Kirk Robbins, Stephanie Clapper here, and our wonderful intern, Lila Martin is here handing out the materials. We urge you to tell us your story. If you want to let us know about a story of how high-cost drugs are hurting you, reach out to one of our colleagues here or to me later and tell us your story individually, and we'll make sure the board knows about it. Very, very important. And we also want your information so we can get back in touch with you. Give us that. We want to stay in close touch with you as we help the board do its job and give them the full authority they need. So at this point, I want to open it up to questions or comments from anybody in the audience. And again, urge you to use the QR code to tell us your story about how high-cost drugs are hurting you. Any questions or comments from anyone? It's hard to hear. Do we have a mic, or do you want to maybe come up here real quick? Good. Tell us your name and your question.
Thank you. My name is Sarah Matthews. I am the founder of the Empowerment Team. I am concerned that the politicians do not understand what the older adult needs are. We don't need prescription drugs. The people who need prescription drugs or assistance with prescription drugs are retirees. I never hear anyone advocate for retirees. Most people in here, the older adults that are in here, we are given too much medication, and there is nothing that has been said about medication review. You say you want us to be active, you want us to be mobile, but how can we be mobile if you're filling us up with drugs? We need help in senior buildings. We do not need any assistance for prescription drugs unless it's a retiree. We deserve someone to assist us, but we don't have that assistance coming from you.
Well, thank you for your comment. I know that there are people who can't afford the drugs that they need, and we want to make sure that they can. And retirees, like everyone, will benefit from the Inflation Reduction Act and the Prescription Drug Affordability Board. Thank you, Laura. Does anybody else want to address? Okay. Thank you for those comments. Any other questions or comments? Okay. Okay, anybody else have anything they want to add from the panel? Thank you very, very much, everybody.